Hi, my name is Ty Reed.
And I'm Bobby Sue Jalifka. And today we are going to talk about celiac disease and its effect on the human body, as well as how it is diagnosed and treated. Stay tuned.
What is celiac disease? Celiac disease is a type of food allergy that affects at least 3 million Americans. It is an immune disease that basically causes your immune system to damage your small intestine whenever you eat gluten. This disease is genetic, and of the people affected, 60% are children and 40% are adults. Celiac disease has been speculated to have been around since ancient times. However, it wasn't officially identified until 1888 by English physician and pediatrician Samuel G. So, how does celiac disease work? On the screen are two pictures of the villi of the small intestine. The one on the left is a normal villi. This one has a larger surface area due to the length of the villi, which means the small intestine is able to absorb the proper amount of nutrients from food. On the right, however, is the villi of someone with celiac disease. Notice how the villi are significantly shorter. In people with celiac disease, gluten initiates an autoimmune reaction that damages the intestinal wall of the small intestine. The lymphocyte numbers in the villi of the small intestine increase drastically, which causes them to kill the epithelial cells, which results in shorter and flatter villi. Now there is a reduced surface area on the small intestine which causes less absorption of water and nutrients, which in turn causes the symptoms. What happens when someone has celiac disease? Well, celiac disease is triggered when someone who has it consumes gluten, causing their body's immune system to overreact and damage the small intestine. The symptoms vary from person to person, but the most common are diarrhea, abdominal pain, nausea, vomiting, and headaches, as well as fatigue and mood changes like irritability and sometimes even depression.
Now, what to avoid when you have celiac disease? This can get very tricky because gluten is in so many common items. First of all, you need to avoid wheat, rye, and barley. These are the biggest items. That means you may have to be mindful of your alcohol consumption. Many liquors and beers use barley and wheat as part of their process. It is also a good idea to avoid oats, as they can be easily contaminated with wheat flour during processing. Make sure to pay close attention to gravies and sauces, as there are many items with hidden gluten ingredients. Ironically, even some vitamins, supplements, and prescription medications have gluten. So please talk to your doctor or pharmacist before taking. With celiac disease, even a trace amount can trigger an episode, which could be detrimental to your health. Let's not forget hair and skin products like toothpaste, lip balms, and lipsticks. Even these can potentially have gluten products in them. Okay, now that you have celiac disease, we need to see what to do about it. Sometimes celiac disease can mimic other gastrointestinal tract conditions, one in particular being irritable bowel syndrome. Celiac disease is typically diagnosed through a blood test. If the test is positive, meaning there are anti-gliadin antibodies or genetic markers, then a biopsy of the small intestine is performed. Your doctor will place you on a gluten-free diet, since there is no cure for celiac disease. The average cost of tests and biopsies combined is upward of $2,100. That, on top of eating a gluten-free diet, will definitely hurt a pocketbook tremendously. As with any treatment plan for any condition, there are risks involved. Because of eating such a restricted diet, there is always that potential risk of malabsorption. The change of lifestyle that goes along with the treatment can also take a toll on your body too. If you have lived a life where you consumed lots of meals on the go, the realization that you have celiac disease will put a stop to that lifestyle altogether. There may also be a need for additional supplements to be taken because the trace minerals in foods that are allowed in the diet may not be quite adequate to maintain a healthful diet.
Some things to know about celiac disease are some risk and environmental factors. Basically, anything that contains gluten, like gluten-containing foods or healthcare products, are examples of a risk or an environmental factor. Now, some preventative strategies to keep from having a celiac episode would include being mindful of what you're eating and to avoid eating anything with gluten.
Ty and I would like to thank you for taking the time to watch our presentation, and we hope that you learned many interesting things about celiac disease and the way it can affect your whole lifestyle.